Okay, so hello everyone and good afternoon. Thank you all for joining and thank you for your participation as well. My name is Dr. Aruj and with me here is Dr. Adnan. We'll be conducting another mock session today with two of our doctors. We have randomly chosen them according to their availability in the group. If you have any questions, meanwhile, please leave them in the chat box. We will definitely be answering those for you side by side or in the end. And we'll be going through just the overview of how the mock session will be conducted. I'm sure that all of us are already aware of it, but just for the sake, if someone if is there who doesn't know about it. Also, it's a humble request to please keep your mics mute so that the participants taking the mock are not distracted. So before we move on any further, I would just like to confirm if Dr. Monica and Dr. Ahmed are there with us. If you are there, then please unmute your mic and let us know.
Yes, doctor, I'm here. I'm Dr. Monica.
Okay, Dr. Monica is there. Thank you, Dr. Monica. You can mute again and we'll definitely let you know when you have to unmute. And how about Dr. Ahmed? Dr. Ahmed, are you there? Okay. Since Dr. Ahmed is not there, there is one participant in the group and she would like to take the case. Dr. Hina, are you there?
Yeah, I'm here.
Okay. So we'll be doing one with you and one with Dr. Monica.
Sure.
Okay. Thank you for coming up and participating. And let's just begin with the first slide. The first will be done by Dr. Monica and second will be done by Dr. Hin, if that's okay.
Yeah, that's fine for me. In
Okay, all
either way.
right. Okay, sure. Okay, so for the general overview, before we start the session, once the station is shown to you, we'll be starting the 90 seconds. Once it is over, the timer, the 8 minutes GMC bell will ring and you will start the station. One of us will be the simulator, the other will be keeping, will be writing the feedback for you. And it's okay if your exam is near, or even if it isn't, you have to show your complete confidence regardless if you know the station or you don't. We make mistakes here, that's completely fine because the mistakes you make here, you will definitely learn from them and you won't make them again. So I hope I'm clear. Dr. Monica, I'll be showing you the station. I'll be starting the timer. Are you ready?
Yes, doctor.
Okay. So your 90 seconds start now.
Begin. Hello, good morning.
Hello.
Hi, I'm Monica, one of the doctors here. I'll be attending you today. So, hi Jacob, can you please confirm your age?
Yes, doctor, I'm 55.
Okay. So, Jacob, what brought you here today?
Well, doctor, I'm very worried. I've been coughing up blood again.
Okay. You mean again? So, since when it started? Can you tell me?
Well, yes, doctor, actually, it has been going on for a few weeks now, 3 to 4 weeks. I have had noticed some streaks about 3 times, but today morning I have noticed it's more than a streak.
Okay, that must be very distressing, Jacob. I can see that.
Mm.
Are you comfortable now to talk?
Yes, doctor, I am.
Yeah, thank you. Has the intensity of your cough increased over the period of weeks?
Yes, doctor.
Okay. Is it something that gives you relief from the cough?
No, doctor, I constantly have this cough.
Okay. And is it anything that makes it worse?
Well, yes, doctor, even if I do little work, it gets worse.
Oh, okay. And is it associated with chest pain?
Sometimes, but that's not something bothering, doctor.
Okay, I'll be asking you a few more questions, Jacob, so that it will give me clear picture about your condition. Is
Sure.
that okay?
Yes.
Yeah. So, is there any fever?
No, doctor.
Okay. Any heart? You felt that your heart is racing?
No, doctor.
Any shortness of breath?
Yes, doctor, that also happens sometimes.
Okay. Okay. Have you noticed that you are losing weight these days?
Well, yes, doctor, I've noticed that I have lost some weight.
Have you weighed yourself?
Yes, I think that in the last 1 month, or let's say 6 weeks, I've lost about 1 stone.
Oh, that's a little worrisome, Jacob. I can say that.
Mm.
What about has your appetite decreased?
I think I can say that it's not the same.
Okay, okay. Any lumps and bumps anywhere in body?
No, doctor.
Okay. Um, can you tell me, have you experienced similar thing in past?
No, doctor, this is the first time.
Okay, Jacob. Any past medical history or history of any surgeries been done?
No, doctor.
Okay, okay. Can you tell me, is there any, are you taking any medications for anything?
No, doctor, not at all.
Any over-the-counter medications?
No,
Are you allergic to anything like food or medications?
no,
Okay. Is there any family history of particular disease?
no,
Has anybody in your family been diagnosed for the cancer?
no, doctor.
Okay, okay. I'll be asking you a few more questions regarding your lifestyle, Jacob. Um, so can you tell me what kind of diet you have?
Well, doctor, I try to eat healthy. I prepare food at home.
Okay,
I take vegetables, fruits.
that's really good to know, Jacob. There are very few people who are health conscious, and I'm really glad hearing that. Uh, do What about physical activity?
Doctor, with this cough and shortness of breath, I'm not able to do any.
Oh, okay, I can understand. I can see that.
Mm.
Do you smoke?
Yes, doctor, I smoke, maybe a pack a day since the last 10, 12 years now.
Okay. Have you ever thought of cutting it down?
No, doctor, I just enjoy smoking.
Okay, okay. What about alcohol? Do you drink alcohol?
No, I don't.
Okay, okay, Jacob. So whom do you live with?
Well, I live with my wife.
Okay, and she's there to take care of you.
Yes, that's right.
Okay, and what do you do for living?
Well, earlier I used to work in a factory, but now I'm retired.
Okay, so can you tell me briefly about which factory are you used to work?
Yeah, it was a dye industry.
Okay, okay, and you were working since past how many years?
Well, I think maybe 20 years before I retired.
Okay, Jacob. Okay. So I'll be doing a few. I'll be doing examination, including vitals, and
Mhm.
will be doing head-to-toe examination, and will like to have closer view of your chest. Is that all right?
Yes, sure.
Before that, Jacob, I would like to have what is going through your mind, like what might be causing this trouble to you?
Well, doctor, this coughing up blood, this is really bothering me. I'm not sure, is it cancer?
Well, Jacob, we will investigate in that line also. We will let no stone unturned so
Mhm.
that we'll have idea about what is going wrong, and
Okay.
we'll try to do our best from our side. I
Okay.
can assure. Okay. So I'll be doing few more investigations also,
Mhm.
including your complete blood count, your urine examination, few liver function test, kidney function test, and few X-rays will be done so that we'll get to know what is happening. How it sounds?
Yes, but Dr. The X-ray has already been done. You want to do it
Okay.
again?
Yeah, it's there in the room. So
Okay.
Okay, so the vital signs are normal. General physical examination is normal, and the chest examination is also normal. The X-ray is there.
okay, thank you so much, examiner. So from my assessment and information provided by you, Jacob,
Mhm.
I have few differentials in my mind. Would like to share with you.
Okay, sure.
Looking at the investigations which we did, I'm little afraid to tell you that cancer might be a possibility,
So, doctor, do you
and
mean
we
this is cancer?
no, Jacob. At present, we would like to keep it at the higher rank so that we will investigate accordingly, and so we will not miss anything.
Okay.
As you said, you're losing weight and you're
Mhm.
coughing out blood,
Mhm.
so that points little towards the cancer. As infection can be less likely because you have never experienced fever
Yes.
from the information which you have given.
Yes, doctor.
So I have decided a management plan for you and would like to share with you.
Sure, doctor.
Yeah. So I'll be reviewing whatever
Continue.
whatever conversation we had. I'll be discussing with my senior also. At
Mhm.
present, I would like to admit you as you're coughing out blood. We'll be monitoring your vitals and uh, So I would like to refer you through a specialist 2 weeks urgent referral to the oncologist.
Okay.
Meanwhile, I'll be giving you few leaflets and pamphlets about your about the cancer and also about the smoking if you wish to discontinue it in anytime soon.
Okay, doctor, I will let you know.
Yeah. Also would like to share some some warning signs like if you
Go on, go on.
I'm sorry, okay. um, if you experience severe chest pain, fever, like cough out more blood, we'll be here to take care of you, and you have to immediately inform us. Will that be okay?
Yes, doctor, I can do that.
Yeah. And also after the treatment, you have to come for the regular follow-ups so we can monitor your health and we can assess your health.
Okay, doctor. Thank you.
Yeah, thank you. Is there anything you would like I might best help you with?
No, doctor, I think that'll be fine.
Thank you so much.
Thank you.
Oh my God, I've done like very bad.
Don't worry about that. At least you have shown the courage to practice here in front of so many people. And it is a practice. It's not the exam, so don't worry. Even if you have made a few mistakes. First of all, I would like to thank you that you have participated in this mock session.
Yeah, actually, I would
Now
like
let
to thank Dr. Aruj and Dr. Adnan for giving me the chance. It was a great opportunity to practice at least. And
You're welcome.
No problem at all.
Okay, now let me give you a few details about how you did this consultation. The first thing, you have greeted the patient in a fine way. You have introduced yourself. That's okay. If we'll just go by the rule, like for example, if you are in the actual exam, the first thing you do when you enter the cubicle is that you tell your name and the GMC number. That is the identification. If you'll just start the station right away, first of all, you'll hear a voice, your name and GMC number first. Okay, so that is your uh, identity. First of all, you identify yourself, then greet your patient, introduce yourself. You did that right. You asked about the presenting complaint, and that was really good. And you showed some empathy when the patient told you that he is actually having blood with the cuff. And next, you asked about the OD para.
yeah.
Okay, you asked about the duration, you asked about the progression. In the progression part, he used a word like, have you noticed any change in intensity? Rather than using the word intensity, keep it simple for the patient. Just ask him like, have you noticed any change? Has it become more often? As a patient told you that I have been having this um, from a few weeks, but now it's become more frequent. So that also shows the progression part. Uh, the next thing, when you are asking about the history of the present illness and you move on to the associated symptoms part, rather than jumping straight away to a particular complaint, you can ask the patient like, is there anything else apart from this cough and blood? Anything else? Ask an open question first. Let the patient tell you anything if he wants to. And even if the patient doesn't tell you anything, if he says no, then you come up with some specific questions, like the way you asked about the fever. That was really good because you ruled out the infection, because cough hemoptysis can be because of tuberculosis as well. You asked about the palpitations. That was really good. uh, you asked about the shortness of breath, and the patient gave you the positive finding that, yeah, I'm having shortness of breath. When a patient gives you a specific positive finding, the next thing you do is ask about a little bit detail of that, for how long you are having the shortness of breath. Okay, and in this scenario, the patient will tell you, I'm having the shortness of breath since I'm having this cough and blood. Okay, so when the patient gives you a positive finding, ask a few details about that. Okay. uh, and next, you ask about the weight loss, which is very relevant here. And the patient gave you the positive history of the weight loss. Whenever a patient tells you about the weight loss or weight gain, always ask that, is it intentional? Okay. So remember that point. Even if it's weight loss or weight gain, always ask that if it is intentional or not. You asked about the appetite. That was really good. And the patient gave you the history that the appetite is not the same as before. You asked about the lumps and bumps. That was excellent. And then you moved on and asked about, like, have you ever had this problem in the past? And you also asked about the chest pain. That all goes fine. That was good. Uh, when you move on to the past medical history, you use the term that, do you have any past medical history of any medical condition? When you're talking to a patient, don't use word the history or any past medical history of any condition, because it's you, the doc, as a doctor, you knows that what we call as a past medical history, the patient doesn't know itself. So you have to ask in the simple words understandable by a layman. Like, you can use the term, by any chance, have you been diagnosed with any medical condition, rather than using the word history. Okay. You asked about the surgical history. That was also good. You asked about the medication, over the counter medication. That was excellent. uh, but you have to tailor your questions according to the complaint of the patient. For example, in the medication part, an important question which comes here is the blood thinners. By any chance, are you taking any blood thinners? Okay, that would be really important to be asked here. Okay. Then you asked, do you have any family history of any medical condition? Again, the same point. Don't use the word history. Rather than ask, anyone in your family been diagnosed with any medical condition? And while digging out the family history, you said that anyone in your family been diagnosed with cancer. don't right away use that word, because if you would have noticed, the patient gave you a alarmed response. Cancer? Oh no, doctor. Okay, so be cautious while using such words. Anyone in your family been diagnosed with any problem with the lungs? Just be general rather than going to jumping to a diagnosis. Okay. uh Next, when you moved on to the lifestyle questions, you signposted it. That was good. But you have to prioritize your lifestyle question. You first ask about the diet and then the physical activity. The diet and physical activity are
It's not
important to be asked, but not more important than smoking. Because as a doctor, you know, when a patient is telling you about the cough and hemoptysis, so the smoking becomes more important over here. And when a patient gives you a history, a positive history of smoking, and it is relevant to your scenario, then you have to ask a few more details about it, like what do you smoke, uh, and for how long you have been smoking. The patient already told you that he has been smoking this much pack of for this long. Okay, you asked about the alcohol. That's good, and the patient gave you the negative history. You also asked about with whom do you live. That is really important, because when it comes to some serious diagnosis, uh, the support of the family and the friends become really important. You excellently asked about the occupation. That was really good, because if the patient has any exposure with the asbestos, that can be a risk factor for bronchogenic carcinoma or mesothelioma. So that was really wise. Even if the patient tells you some other profession, like the patient tells you that, doctor, I work as a postman. So even then you have to ask him any previous occupation, any previous exposure with the asbestos. Okay. uh, and then you ask about the ideas of the patient. Okay, that was really good. You can ask about the ideas at the any point after the history, before starting the management. That can be adjusted anywhere. And over there was a slight mistake, that the patient asked you a specific thing, that I'm worried if that might be a cancer. So remember, whenever a patient raises a concern for cancer or some disease like myocardial infarction, like a heart attack, whenever the patient says, doctor, I'm worried if it might be a cancer, ask the patient ideas. May I know why you think so? Because there might be some story in his mind. He might have seen some other person who was coughing up blood, and later on came out to be diagnosed with the lung cancer. So he might have seen somewhere. So you have to ask the patient, may I know why? Okay. And you reflected back appropriately at that moment, because you don't know the diagnosis yet, so you cannot exactly tell the patient if it is a cancer or not. So you did right that I will get back to it after doing the examination and some test. Okay, so over here, and your history completes, and next you moved on to the examination part. Try to be more specific while telling telling what would you like to examine. Like in any scenario, you have to mention that I would like to just check the vital signs that include your pulse, blood pressure, temperature, breathing rate, oxygen content in your blood. And then you can add on some specific clinical relevant examination depending upon the complaint of the patient, which is the chest examination over here. Okay. And while telling the examination, yeah, that is really good that you have added the investigation part as well. But in the investigation, you asked about the urine examination. That was not relevant here. The important relevant thing over here is, apart from the baseline investigation, I mean the CBC, LFTs, RFTs, and serum electrolytes. Apart from all those tests, the next important is a chest X-ray, which the patient told you, doctor, it is already done. So when you are given a specific note in the scenario that the X-ray is already done, pay attention to that description of the scenario, because otherwise the patient will tell you just like the way, like, it is already done, why do you want to do it again? So it will just waste your few precious seconds. So you can just say, we have already done your X-ray, I will review that. One more important thing in the labs is you have to mention about the PT and APTT in the simple words. I would like to do some other tests to see how thin your blood is. because the cough and hemoptysis, it's not essential that it is always a cancer. It might be something else, like the patient might be having a problem with the clotting factors. Okay, so that's why he's coughing up blood. Okay, uh, and now here comes the diagnosis part where you have revealed the diagnosis. uh, so never ever tell the patient directly that it is a diagnosis of cancer. And secondly, even if you are thinking that it is a cancer, tell in a proper layering way. You have to come to this question, sorry, you have to come to this point by asking a few questions. Like the patient raised the concern previously, is it cancer? So you can just say, as you previously raised your concern that if it might be cancer, and at the moment just a x-ray is not a confirmatory test that it is a cancer. So we are suspecting a cancer based on these history findings and the x-ray findings. We are not 100% sure if it is a cancer or not. So the management depends on, like, first of all, we are going to make it sure that if it is a cancer or not. Okay, so the more appropriate way will be, as you previously raised your concern that you're worried if it might be a cancer. Okay,
Yeah.
if you have not asked the patient previously that may I know why you are concerned about it, you can ask over here. And then you have to say, uh, from what you have told me, based on the examination and the x-ray we have done, it seems like it can be, unfortunately, a cancer, but at the moment I'm not sure about it. Okay, tell the patient that you are not sure. Don't label a clear-cut diagnosis of cancer.
Yeah. Yeah.
And you have to tell him that what you are gonna do now. Okay, as you said that it is less likely an infection because you are not having a fever. Okay, and you said we have decided the management plan that we will admit you, and then you said we will refer to the oncologist.
Yeah. Two
So
contracts.
when it comes to the management part, it becomes really important that what's your current setting. If you are sitting in a GP clinic or in a hospital, so you were already in a respiratory department. Okay, and even if you are suspecting a diagnosis of the cancer and the patient is not acutely ill, the patient is not vitally unstable, you don't need to admit this patient. You will just say, I will ask my senior to um, assess your condition. Okay, because it is really important that when you are suspecting a CS diagnosis, involve your senior right away. You don't need the admission in this scenario. And the next thing, don't refer to the oncologist unless until you have made up a diagnosis. So at this point, the part of management is to give the initial treatment, which is not that specific over here. And the second thing is to confirm a diagnosis. You have to tell the patient, we will do a CT scan. We might need to do bronchoscopy, explain the bronchoscopy in detail, and then tell him that we wish that it doesn't comes out to be a cancer. We really wish that. Okay, and unfortunately, if it comes out to be a cancer, then we have a few treatment options that depends upon the size of the tumor, and and that is relevant only when the patient is concerned and the patient asks about about the treatment part, that what you can do for the patient. Okay, so let me just conclude this management part. You have to say, I will inform my senior, he will review your situation. Okay, we will do some further specific tests like CT scan, and we might need to do bronchoscopy. Explain the bronchoscopy in the simple words, and then tell him that by these tests we would like to confirm the diagnosis, and we really wish that our suspicion is wrong and it's not cancer. Okay, and if it comes out to be cancer, would you like me to tell you what are the treatment options we have for you? And if the patient says, yeah, tell me the treatment option, then you have to tell him that it depends upon the size and the type and the location of the tumor.
Yes.
Okay, we have some surgical options, some medications like chemotherapy, and we will tell you the details of that later on, and you told the patient about the warning signs, and you use the word warning signs, that let me tell you the warning sign. The patient doesn't know what are the warning signs, so just tell
Yeah.
him that by any chance, if you feel any shortness of breath, chest pain, or you feel that the quantity or the frequency of the blood is becoming more, then you have to come right away to back to the emergency. Let's say if you were in a GP clinic, then you can, what you should have done is that I will refer you to a hospital, a specialist, a chest specialist, within a 2 weeks time, a urgent referral. If you are in a GP clinic, you will refer the patient to the hospital. And if you are already in a hospital in a respiratory department, you will just tell the patient that we will review you in 2 weeks. Okay, a specialist will review your situation in 2 weeks, and we will do these tests. Okay, and meanwhile, you can signpost the patient, because you will be sending him home, because it does not need a admission, so you can signpost. Anything you would like to ask?
Yes, doctor. I have two questions.
Yeah, sure.
Yeah. So if the note is given in the brief history which we get before starting the session, like the chest X-ray is provided, but while talking about the investigations, so how to convert it in words, like chest X-ray has already been done for you, or like kind of.
Mm-hmm. So you can say,
I
I would
want.
like to do your vital signs, and after that you will tell about the specific clinical examination, that is a chest examination. And when you are going to narrate that what investigation you would like to have, you can say, I would like to do some routine blood tests to see if you have any weak blood, how your liver and kidneys are functioning, how thin your blood is, and we have already done your X-ray. I will review it.
Okay,
That's
okay.
it.
But yeah, I'm so sorry. But then if chest X-ray has already been done, can we say in investigation part only that we would like to do CT scan of the chest, or no?
No, because after telling the examination, what investigations you are adding is the routine initial investigations. Okay,
Okay.
only initial investigations that we mentioned over here. Let's say you also need to do bronchoscopy in this patient, but you are not
Yeah.
gonna tell straight away
In
in the very beginning that we might also need to do the bronchoscopy, because you will come to that part. The specific tests are left for the later on part of the
I'm
management.
sorry for interrupting, but the meeting might get over in a few seconds.
okay.
Right, so I'll be sending the link again.
Okay.
Yeah. Thank you, doctor. I'm done. Thanks a lot.